Remember back in the old days when we used to get sick, have some symptoms, and we would Google those symptoms. And then it would typically lead us to WebMD. Then we could self-diagnose 3 diseases, 2 viruses, go to our family doctor and explain to them exactly what was wrong with us and get the care that we need. Well, now we ask AI. It's changing. What used to start with a Google search now starts with generative AI, and it is reshaping how medical care begins. Let's talk about it.
Welcome to the AI for Everyone Daily Brief.
Well, there is no question that AI is going to have major impact on our healthcare and the industry. So I want to make sure that as all of this progresses, that we're staying abreast of this because it impacts each and every one of us. I found an international survey of more than 2,000 doctors and nurses, and it reveals that, shocker, more people are hitting up generative AI to self-diagnose before they go to the doctor to seek care. Now, again, this is not a shocker. ChatGPT is the fastest growing platform in history. More people are being exposed to it. More people are learning how to use it at a higher level. We have browsers coming out now. Perplexity keeps improving what it's doing. And Google now has Google AI mode that they're slowly morphing into. So this is only going to become the norm as we move forward. In the United States, 75% of clinicians report that AI misinformation is causing a challenge with patient compliance. Now, this can mean a few different things. One, we are absolutely overly trusting the AI, and that's human nature. I did a video on it right here that when something sounds authoritative, sounds like it knows what it's talking about, we tend to believe it. It's just human nature. On the other side, in the medical industry, there has absolutely been a lack of trust in the industry as a whole. When we talk about things like big pharma or the medical industry and hospitals for profit and all those things, there's been a crack in the armor of trust when it comes to our healthcare providers. So you kind of have this perfect storm happening here right now. More than half of these clinicians report that they are spending time in the appointment unwinding some of this AI misinformation. Now, again, back to the snowball effect, if doctors and nurses are spending time unwinding this misinformation, then they're spending less time giving you the actual care that you need. And if your appointment for some reason rolls over, then that's impacting the care of the people after you. So it's something that we have to think about and consider. And nearly 1 in 2 medical professionals believe that most patients will self-diagnose using generative AI in the next 3 to 5 years. Now, I don't know who the 50% are that don't believe this is going to happen, but maybe that's why there's some lacking of trust in the medical industry. Why this matters? Well, this is about more than the impact of technology on the medical industry. This is about time. This is about trust, and this is about access. And clinicians are under strain. My wife's a nurse. I see the medical industry. I see the workload that are under. So I have a lot of empathy for folks in these jobs. 69% are seeing more patients than they were 2 years ago. I mean, 2020 really did a number on the medical industry. And nearly half of these clinicians are stating that fatigue is impacting the quality of care they provide. Think about that. Our truck drivers at this point have more restrictions on what they can and can't do than what many of the folks in the medical field have. Think about that. And as the system tightens, patients are looking elsewhere, right? Public AI is accessible. It's available. It's fast. It sounds very intelligent. It's confident in the tone when you ask it a question. But the problem is it lacks context. It lacks clinical training. And yes, it lacks accuracy. It's not quite ready for prime time yet. So this dynamic is affecting much more than just the diagnostics of the industry. It's reshaping the relationship between patients and providers. And that's a challenge because it's introducing a lot of friction at a time when really everything should be crystal clear from start to finish when you go to your doctor. How this impacts you. Well, if you're running a healthcare team, your staff is probably taking a chunk of their day unwinding these AI misconceptions. And that causes a challenge in workflow, trust, and potentially patient outcomes. If you don't work in the medical industry, take note because the dynamics here are very similar when it comes to law, education, finance, consulting. Clients are showing up with answers, not questions, right? They have access. So they're going to be coming in much more educated in some instances, and in others, they're going to have misinformation. So the challenge now is not whether people are using AI, but how we deal with it. How are we going to respond when people come in and AI becomes the first opinion, and now you are the second opinion? We need to have policies in place in how we deal with that. What is something that you can do right now as all this unfolds? Well, I might be a little bit biased here, and I don't want this to sound like an infomercial, but schedule your team for an AI workshop. This is so critical over the next few years. AI literacy is going to be one of the most important things that you're going to have to deal with moving forward. Not just in the way that your team uses AI or the policies internally of how you use AI, but how you respond to other people who are using AI. And that's where communication is going to have to be improved. Emotional intelligence, your self-awareness, your managing of your emotions as people do come in and question your authority or question your expertise. How are you going to deal with all of that? Your ability to look at problems and be able to define those problems and understand the key outcomes that you want. These are all things that we need to make sure that our teams are getting training around, because this is the future of work. Oh, and one more thing. Come here. The exam room is no longer the first stop. AI is. And if your business is built on trust, and most of them are, we are no longer questioning if people are using AI. So we need to focus on what are they learning before they get to us, and how do we respond to that information, especially if it is false. Are you ready to have that conversation? Well, that's it for me today. I hope that this episode created some value for you. If so, hit that subscribe button, like button, leave a comment, get in the conversation. And that's it for me. My name is Harrison Painter. This has been your AI for Everyone Daily Brief. And until next time, keep creating, keep innovating, and most importantly, keep up. God bless.
Thanks for listening. I'm glad you stayed. One more spark for the plans you've made. If this show hit, go share the vibe. Like, subscribe, let's build this tribe.